Hello, good morning. My name is Johan Hernandez. I'm your provider today. I'm gonna be seeing you today. What's your name?
My name is Ibe Hernandez.
What's your age?
I'm 33.
Okay. Would you consent for me to perform this physical exam on you, record you, and I'll also publish the video for the university?
Yes.
Oh, thank you. What can I help you today?
Oh, I'm here for my physical exam, my annual checkup.
Oh, that's nice. Okay, I can sure help you with that. Is this for school or for work?
For school.
All right, thank you. Okay, any problems that you can tell me that you have?
No, I don't have any medical
Okay.
condition.
What about, let's talk about your skin. Do you have any rash, open wounds, or any fungus that you can know of?
No, I don't have any rashes or
Have you ever had any problems in your skin?
no, none that I recall.
No, usually no allergies, nothing, or redness, nothing like that.
No,
Good. What about have you ever had any traumas on your head?
no,
Have you ever experienced like constant like throbbing headache that doesn't go away with medications?
no, no.
Nothing like that. How's your sight? Do you see very well?
Yes, I checked my sight recently and I have 20/20.
Oh, good. So you never use reading glasses or nothing like that.
No, I don't wear glasses.
Okay. What about eye pain? Have you experienced any like that? Anything like that?
No,
Oh, double vision.
no.
Um, when was the last time that you visited an ophthalmologist for an eye exam?
Last year, I think
Okay, and how did it go?
it went well.
Okay, so that's great. What about any hearing problems, ear pain, any discharge coming out of your ears?
No, I think that I have like a infection when I was a kid, but nothing recent.
Okay, what kind of infection? Like otitis?
Like a titus.
And you take medications for it and it resolved?
Yeah.
Good. Anything similar lately?
No,
What about any pain on any ears?
no,
Any ringing, any thumping?
no.
Oh, good. Um, how is your nose? How's your breathing? Is your breathing okay?
Yes.
Have you noticed any irritation in your nose?
No,
Any bleeding through your nose?
no,
No. Um, what about your mouth? Is your mouth okay? Have you experienced any gum bleed? Any trauma in your mouth?
no, no,
Any problems surrounding your tongue or injury in your teeth?
no. I usually check with my dentist.
You go to the dentist and everything is okay?
Every 6 months. Yes.
Good. Do you have, how's your, let's move down to your neck. How's your neck? Do you feel, you move your head okay?
Yes, I can move
Side
it.
to side? No problems like turning your head all the way around?
No,
What about swallowing?
it's okay.
You swallow okay? Have you experienced any like throat, like it's too dry?
No, no,
No dryness? No excessive salivation either?
no,
Good. Do you have any medication allergies?
no. I don't.
Any latex allergy?
No,
What about any environmental allergies?
no,
Food allergies?
no.
So you don't have any allergies at all? Oh, good. Um, have you noticed, did you do your self-evaluation for your breast?
Yes, I do.
Have you noticed any lumps or any stiffness, painful tissue in any of your breasts?
No,
Any abnormal discharge coming from your
No.
breast?
No.
Do you have any questions for me regarding your breast or something?
no. I usually do my
Your
my
self-exam? Okay. And how's your, let's go back to your breathing. How's your breathing going lately? Is your breathing okay?
Yeah, it's fine.
You breathe fine?
Mm-hmm.
Have you experienced any cough?
No,
So no one in your family has noticed that you snore while you sleep?
no,
Okay, good. Any abnormal sneezing?
no,
What about like if you have you noticed like the fingers on your nails goes blue, maybe on your toes?
no,
They don't change colors.
no,
Okay, what about your heart? Is your heart okay? Have you experienced any chest pain ever?
no,
No abnormal palpitations?
No.
Do you feel like sometimes when you go from sitting to standing, do you feel like dizzy ever?
Sometimes.
Sometimes. Do you have you ever been diagnosed with any problems with your heart?
No. No that I recall.
Okay. So you haven't experienced any chest pain, any abnormal palpitations?
No.
What about night sweats?
No, I don't sweat generally.
Okay, so there's no problem, any sleep disturbances?
No.
Okay, let's keep moving. How's your appetite?
It's good.
Have you noticed any change in your appetite lately? Like, have you eaten too much than usual, or maybe too little than usual?
No, I have been eating the same.
Uh, um, do you have like heartburn? Have you ever experienced heartburn?
No.
You know what that is, right?
Yes.
What about any indigestion?
No. No.
Any constipation?
No.
What about diarrhea?
No. I usually go regularly to the bathroom.
And when you go to the bathroom, have you experienced any change in the color of your stools?
No.
Nothing. What about any nausea or vomiting that suddenly comes to you?
No.
Everything is okay?
Yeah.
Okay. So tell me a little bit about your menstrual period. Is it common on a regular basis?
Yeah, I usually get it. Usually, no, I get it every month, every 28 days. It's pretty regular.
Okay. Are you sexually active?
Yes, I.
Did you take contraceptives?
I don't.
You don't have. Are you? Do you want me to talk to you maybe about contraceptives later on?
Yeah, we can talk later on.
Okay. Do you have any maybe abnormal cramps, abnormal pain while you're menstruating that you can discuss that to me?
Sometimes I get some cramps and menstrual pain, but it usually goes away with ibuprofen.
Oh, good. Have you noticed any skin color pigmentation changes on your on your
No.
on you? No. Any abnormal parts of your body where you see hair?
No.
Oh, how's your urine? Is your urine okay?
Yeah, I go regularly to the bathroom.
And then is regular yellow, amber?
Yes.
You don't haven't noticed any maroon or tinted urine?
No.
Any pain during urination?
No.
Any burning?
No.
Have you experienced any infections in the lately?
No, I haven't had an infection.
No urinary infections. Okay. Okay. What about joint pains? Have you have any joint pains either on your shoulders, on your arms, legs, knees?
No, I usually get back pain when I'm sitting for
Long periods of
Yeah.
time. And what do you usually do when you get those back pain?
I just take Tylenol, ibuprofen, and I just take a walk or do
Yeah,
something
I
else.
was gonna mention that when you get back pain, it's very important to stand up, if move around and stretch a little, because normally the muscles are having tension. And does that happen very often?
Not that often, but sometimes, depending if I'm sitting for long periods of time.
Okay. Uh, what about, have you ever felt like numbness or tingling in any of your legs?
No.
You feel like muscle cramps?
No. No.
Nothing? Any discoloration or losing temperature on your legs?
No. I don't.
Any swelling or any of your joints?
No. I usually don't get any swelling.
Do you have arthritis, gout?
No.
What about have you experienced any seizures ever?
No.
Any problems to fall asleep?
No.
Any headaches?
No. Sometimes I can get headache, but it's not frequently.
What do you usually take for your headaches?
I take Tylenol.
It works well?
Yeah, it usually works well.
Any seizures, history of seizures in the family?
No.
Have you ever lost consciousness suddenly?
No.
Again, have you ever felt like ants walking on your hands, like tingling?
No.
No numbness in any of your body?
No,
What about your blood? Have you noticed any easy bruising on your any part of your body?
no, no,
Have you ever been diagnosed with anemia?
no,
Have you ever got a blood transfusion?
no,
Okay. Have you ever had any bleeding problems?
no.
How is your mood feeling lately? Have you been like feeling energetic or feeling? Have you feeling like energetic or feeling down lately?
No, I think that my mood is very stable. I haven't felt depressed or anxious.
Any fatigue?
No,
Any increase in appetite?
no,
Have you ever been diagnosed with like thyroid problems?
no,
Never heard of it. Any heat or cold intolerance?
mm,
You or actually when you go in the cold, you feel too much cold more than regular.
no, no, no. I haven't had it.
Do you have diabetes?
No, no, that I'm
Never been
aware.
diagnosed with diabetes.
No.
So tell me a little. How do you manage stress?
I usually, when I feel stressed, I usually take a walk or I do something that it just take away all the pressure from me. I can play with my kids. I can start cooking. I can go for a walk. Sometimes I read. It just depends.
Good. Have you ever been diagnosed with anxiety?
No,
Have you ever been diagnosed with depression?
no,
Do you feel like you sometimes are too sad to manage
no, no,
or maybe too happy to control?
no, no,
Have you ever been in treatment with any psychiatry?
no. I've never seen a psychiatrist.
Okay. Have you ever have thought about injuring yourself or maybe injuring others?
No, no, never.
Okay. Tell me a little bit about what do you do regularly? Do you work? Do you study?
I study. I'm in med school, and I
Oh,
usually study.
congratulations.
Thank you.
So you pretty much know about all that I'm doing with you. That's great. What are your hobbies?
I like to read. I like to go hiking with friends. I like to cook. Like or dislike, but
Oh,
I
that's great.
usually cook.
That's great. Yeah, actually, cooking is very important because that way you can manage your own nutrients. Can you describe a regular diet for you?
Yeah, sure. I usually in the morning drink coffee. Um, and sometimes I eat some eggs or bread. It just depends. Some fruits. Um, sometimes I eat lunch. Not very often because I don't have the time. But I usually go straight to dinner and I eat with my family rice, beans, meat, vegetables, whatever I'm cooking for that day.
Oh, that's great. That's great. And that helps you maintain a healthy lifestyle. That's very good. And you seem to be very active. You told me that you do hiking with your friends.
Mm-hmm.
So you do that like once a week, twice a month. How often do you do that?
It depends on the weather. It can be twice a month. Sometimes I don't do it in a month.
You know, it's
Just
very
depends.
important to keep active. Did you do any other type of physical activities?
No.
Not really. So it's very important that a young person like you maintain a constant movement, because the more we move, the better our body is accustomed to be active. And believe it or not, there are studies that help understand better the way how exercise prevents certain disease. So ideally, we would like to do 3 times a week, at least 30 minutes every time we go to do some form of exercise. But that's pretty cool. Did you smoke?
No, I have never smoked.
Have you ever smoked?
No.
Did you use any recreational drugs?
No, never.
Have you exposed to secondhand smoke?
Maybe.
Where?
From friends that I usually smoke.
So it's very important that you avoid those situations. It would be convenient if your friends are smoking that you step outside and don't inhale those smokes, because secondhand smoking is like you were smoking as well. So it's very It's one of the causes of lung cancer and heart disease. So
Okay,
if you
sure.
can avoid that, it would be better for your overall health.
Okay, sure. Thank you.
Did you drink alcohol?
Socially,
What do you mean socially?
uh, maybe once a month when I go out or we have friends coming over. Sometime month pass and I don't drink. It just depends.
Okay, and when that happens, how many drinks do you get?
I get one or two, maybe three, not more than that.
Okay, so it doesn't happen that you're drinking suddenly you go in and you drive.
No, no. I usually when I drink, I stay home. And if I'm outside drinking, I usually have someone to drive me.
Oh, that's good. You shouldn't ever try to mix alcohol and driving. And do you use your seatbelt when you're
Yes,
driving?
all the time.
Oh, can you tell me a little bit about your family history? You have mom and dad are alive.
Yes, they're both alive.
The what about? Let's talk about your dad. Does he have any medical problems?
Yes, he has hypertension. He has diabetes. Diabetes. I think that one time he had gout. I'm not sure. Yeah.
Oh, okay, and that's control.
Yes, all, he takes medication for all of those.
Okay, what about your mom?
My mom has only hypertension,
That's it,
and
control.
yeah, she takes medication. It's well
Good.
controlled.
Okay, let's talk about your grandparents. Tell me a little bit about your grandfather, your grandmother from the side of your father.
Okay, for my father's side, my grandma is still alive. Uh, I'm not aware of any medical condition. She might have like arthritis and some age disease, but nothing serious. My grandfather died from heart disease. I'm not aware which one.
Okay, let's move on to your mother's parents.
Okay, my grandfather from my mother's side, I never met him. I don't know. He's dead, but I don't know why. My grandmother from my mother's side, she passed away from cancer, uterus cancer, ovarian cancer.
Oh, sorry to hear that.
Right.
Did you have any siblings?
Yes, I have two. I have a brother and a sister.
Are they healthy?
No, they have my sister. She has diabetes and hypertension, and my brother. I think that he's healthy. I'm not sure.
Okay. Oh, yeah.
Do you have kids? Do you have? I
Yeah,
don't.
they remember that this. So, are you married? Do you have kids?
Yeah, I'm married and I have two kids.
Are they healthy?
Yeah, they're pretty healthy.
Oh, that seems to be good. Okay, so do you have any questions for me?
No, I don't have any question. Thank you so much for your help.
All right, so we can discuss the problems that we mentioned before if you want, but I think this conclude our first interview for a general physical exam.
Thank you so much.
Thank you.
Thank you.